Welcome in the Lesson 2 of the EFN Digital Skills for Nurses course. Lesson 2 will provide you a deeper insight into digital health for nurses, offering an understanding of what digital health entails and how you can apply the digital tools in nursing profession. This lesson primarily relates to the core competency 1, which is the competence to independently diagnose the nursing care required using current theoretical and clinical knowledge and to plan, organize, and implement nursing care. As we have all seen, the pandemic has significantly accelerated the digitalization process, highlighting all the advantages and benefits of these tools, not only in the pandemic. In terms of digitalization and innovation, the world has undergone important changes, which have changed not only lifestyles, but also and above all the way of working. Nowadays, digital skills are seen as necessary and, as such, require constant investment and progress. In this regard, the European Commission has set very specific objectives both in the European Skills Agenda and in the Digital Education Action Plan. Among the goals to strengthen digital education is to ensure that 70% of adults have basic digital skills by 2025. Digital skills and the digitalization process are a key and a priority topic for nurses. The healthcare sector is mostly provided by nurses who represent the majority of the healthcare professionals. Digitalization of healthcare is completely transforming the way healthcare is provided by nurses and other healthcare professionals. These changes will also enhance the impact of the clinical experience and the patient outcomes. From an EFN perspective, it is essential that the digitalization of healthcare remains a priority for the European Commission, but above all that the voice of nurses is heard and taken into account in the development of policies fit for purpose. Frontline nurses know what the healthcare system really needs and what patients need to receive quality care. Therefore, they know what is important to develop for supporting frontline work. Therefore, involving them throughout the process is a key priority. In 2022, the European Commission launched the European Health Data Space, which aims to support individuals to take control of their own health data, support the use of health data for better healthcare delivery, better research, innovation and policy making, and enables the EU to make full use of the potential offered by a safe and secure exchange, use and reuse of health data. This represents a big step forward for the healthcare systems. For nurses and healthcare professionals, having access to patients' health data allows them to provide better quality care and at the same time ensuring better protection and privacy. An electronic health record is a digital version of a patient's paper chart. The electronic health records are real-time, patient-centered records that make information available instantly and securely to authorized users. While an electronic health record does contain the medical and treatment histories of patients, an electronic health record system is built to go beyond standard clinical data collected in a provider's office and can be inclusive of a broader view of a patient's care. The electronic health records is an important part of the health IT, and it can contain Patient's medical history, diagnosis, medications, immunization dates, allergies, treatment plans, radiology images, laboratory and test results, and importantly, the information to construct the nursing care plan within a continuity of care approach. The electronic health record supports nurses in relation to planning the wound care, diabetes and glycemia follow-up, IV therapy, oral medication, pain management, to name a few. Through the electronic health record, nurses have access to evidence-based tools, adapted care plans, allowing them to make informed decisions to a patient's care and treatment, assuring this way the highest level of care for the patient. A nursing care plan is a formal process that correctly identifies existing needs and recognizes clients' potential needs or risk. Care plans provide a way of communication among nurses, their patients, and other healthcare providers to achieve healthcare outcomes. Without the nursing care planning process, the quality and the consistency of patient care would be lost. A good example is a wound care plan. Adapted nursing care plan will be proposed what treatment to follow for certain wounds. Is it a surgical wound, a bad sore, a skin tear, a burn, a fistula? How deep is the wound? Is there infection in the wound? What is the color? Through digitalization, an adapted care plan with proposed treatment will appear. The electronic health record will be supplemented with pictures taken by the nurse, also in the community care. An advanced practice nurse with nurses' prescribing ability can always be consulted for advice for the wound care and e-prescribing wound care products, and this advice is integrated in the electronic health record. Good care plans are an excellent support for nurses and can be useful in various situations, such as, for example, in cases where patients appear to have hypoglycemia or when diabetic patients are fasting for an operation or examination. An adjustment schedule for insulin will be proposed through digitalization. This allows nurses to work autonomously, smoothly and efficiently. The glycemia values and the insulin administered and are registered by nurse and can then be clearly found in the electronic health record. An example is the IV insertion site, which, thanks to the use of digitalized system, can lead to better outcomes for patients. Every shift, the responsible nurse must sign off in the care plan the status of the IV insertion site. If the insertion site is hardened, red, or there are signs of minimal infection or pain, the nurse will remove the IV and insert a new one. The new IV insertion location must be adjusted in the care plan and automatically will appear IV day 1. The insertion of previous IV site should also be observed and digitally reported. If necessary, local treatment with ointment will be started and indicated in the digital nursing care plan. An important digital instrument is the early warning system, which is able to warn when the patient is worsening and to propose new actions to avoid further worsening or even prevent CPR and, in worst case, prevent even the death of a patient. If the score identified by the system is abnormal, it is necessary to notify the doctor and record all the nurse's observations, medical orders and actions in the electronic health record, as well as the monitoring of vital signs, oxygen saturation, urine flow, and consciousness. The early recognition of a sudden worsening of the patient's condition and timely intervention can save lives through optimal digitalization of the nursing care process. Regarding the pain screening, it is important that this is monitored several times a day, and in the case of a positive pain score, medications can be administered by the nurse using the basic pain protocol of the healthcare facility, unit, or the community. Next, it needs to measure the effect of this drug and pain within an hour, and all these values are obviously clearly visible in the patient's nursing care plan and in the pain he's highlighted. This is a process that, if digitalized, would be more efficient and effective. Even in blood transfusions, digitalization could be of great help and support for nurses by simplifying the entire process. By eliminating documentation proceeding with an active patient identification and a scan of blood products, administration would be much safer. Additionally, monitoring vital signs and any transfusion reactions are documented in the electronic medical record. To digitize the healthcare system effectively and efficiently, it is essential to involve nurses in the development of new digital skills and tools. In this regard, the Global Health Strategy on Digital Health 2020-2025 can be a great instrument. This strategy aims to build an inclusive digital economy and society, develop human and institutional capacity, protect human rights and human agency, promote digital trust, security and stability, and foster global digital cooperation. Cooperation is a key objective. In fact, cooperating and co-creating with frontline nurses is important to boost the progress and an innovation that can truly benefit the entire healthcare ecosystem. Thank you for following the lesson 2, and let's proceed to the lesson 3, in which we will give you an overview on the collaboration, training and student education to digitalize the healthcare ecosystems in the EU.